Good morning. Pat Ziemer here with MagnaWave. Tuesday morning, MagnaWave office hours, where we come together every Tuesday, answer your questions, discuss whatever it is you might like to talk about with regard to PEMF, MagnaWave, machines, devices, training, protocols, guidelines, whatever it may be that you would like to discuss. We're certainly here to visit with you on these Tuesday mornings. So, a couple of things here coming up. EquestriaCon this next week at the Breeders' Cup. MagnaWave will be there. As a sponsor of the EquestriaCon event. We look forward to broadcasting live from there and documenting what's going on with EquestriaCon and having a good time. If you're able close by and you can come join us, please do so. I think you'll find it fun and interesting. A couple of things also, if you're not with us on Alexa, MagnaWave flash briefings are now available on Alexa. You can use your Echo device at home. You can use your phone if you have the Amazon Echo app on your phone or Amazon Alexa app on your phone. You can also put Alexa on your iPhone and say, Alexa, what's my flash briefing? And you'll receive a quick flash briefing from Alexa or myself, or an interview segment with someone further describing or talking about MagnaWave and PEMF and the benefits and how it can best be used for health and wellness or to help you build your practice, whatever the situation may be. Come join us on Alexa. And if you do, we're going to be giving away some neat gifts and prizes on Alexa, so stay tuned and listen to the broadcast, because it'll tell you at the end of one of the flash briefings, text this to do this, text this, and you'll receive some free gear or whatever the situation may be. So join us on Alexa. It's a lot of fun, and it's a great place just to get your daily boost of refurbished information that you knew but maybe you had forgotten about, information if you just want to learn more about PEMF. Join us on Alexa and live and learn a lot about MagnaWave and PEMF. Also, just want to mention that kind of keep an eye out. The Association of PEMF Professionals is a national association that's being established for those of us in the business as PEMF professionals to come together, to learn, to have some lobbying done for us by the organization for various rules and regulations that may come up that we need to address. So it's the Association of PEMF Professionals. Launching, I believe, November the 1st for membership to actively join. We're signing up to be a corporate sponsor of the AOPP, as well as some other manufacturers are doing it, distributors are doing it, people like ourselves as supporting businesses to be a part of that, and then certainly doctors, practitioners, massage therapists, anybody in the country that uses PEMF and wants to be a part of this professional organization will certainly be able to join at that time. So keep an eye out for that, and you'll be seeing that and learning more. If you have any questions that you'd like to discuss with me today by calling in, the number is 502-599-9972. It's 502-599-9972. What I want you to do is send a text to that number with your name, and then I will call you back. That way we don't have multiple people trying to call at the same time. Send a text to 502-599-9722 with your name, question if you want to put that in there, and we will call you right back and have a conversation with you that you'd like to discuss. These are really good because people ask me questions. I've got some questions I want to go over today that I've received in the last few days, but sometimes someone has a question and I provide a feeling on that or some information on that, and then it's good to have a conversation because subsequent questions come up, further clarification comes up. So if you'd like to participate in that fashion, please do so. Anybody that calls in today will receive a packet of the MagnaWave News and Views. There'll be 100 copies of the MagnaWave News and Views newspaper, which is great as a handout. Set it around town, put your stickers on it, put it around town, spread it around the show, whatever you might want to do. It's just a great piece that talks about PEMF, a lot of history, a lot of background on PEMF in the MagnaWave News and Views. So if you give me send me a text and we talk today, you'll receive 100 copies free. It's about a $35 value of the MagnaWave News and Views. We want to share our gear and our promotional products with our practitioners or anybody that calls. If you're someone that calls today and you're not a practitioner and the News and Views would not be beneficial for you, then we'll certainly get you another piece of gear, we'll have that conversation when you give us a call. So send me a text, 502-599-9972, to visit with me live on the air today on the MagnaWave office hours. So, excuse me, got a little bit of a cough there. I apologize. Don't have a cough button or anything that pops up when you're live on the camera. You really don't have that when you're on the radio. We used to have a cough button. We could hold the button in, turn off the microphone, and then we could cough or whatever, or sneeze or whatever the situation may be, and it wouldn't go across the air. Enough, a little bit of history. So, a couple of questions. Here's a question. Sister is due to have her baby at the end of November and has been seeing a chiropractor. They want to dry needle a muscle in her butt, in her area, muscle in her rear. I was wondering if she could safely be treated with the MagnaWave for that, along with her swollen ankles and feet. Well, certainly, as a rule, Magnawaving, actually, if you're pregnant, or a pregnant mare, or a pregnant person, whatever, a pregnant woman, whatever the situation may be, most often, most anything is contraindicated during pregnancy. Now, with that said, common sense is certainly something that is needed to be followed, and you can certainly talk to your doctor about that. But if they're going to dry needle a muscle in the rear end, and you wanted to treat that muscle in the rear or in the butt with PEMF, there's really no reason that you wouldn't be able to do that. The reason it's contraindicated so often is certainly you're going to, the modality can move. It moves tissue, it moves muscle, and we don't want to do anything to topically over the area of the fetus to cause any movement, or unnatural movement that may not normally be there. So certainly we wouldn't treat over, around, or near that type of situation. But again, if you talk to your doctor and say, can we treat the hip? Can we treat an area of the buttocks? Can we treat the ankles that are very swollen, that person is having trouble walking around? It's not like we're going to put this device on somebody for an hour or 2 hours that you could have whatever someone might want to discuss. That's not the case. To go in and treat a particular area for 3 to 5 or 6 minutes, or to treat the ankles or the feet for 6 to 8 minutes to help with inflammation reduction and so forth, is something that a lot of people have done, and it's certainly, I would recommend that you clear that with your doctor. But there should be no problem with doing that away from the area as long as you have doctor approval. We don't diagnose. We're not trying to say that this is going to be the way to do it, but certainly certainly in pregnant mares, for example, there have been situations where all of a sudden the mare is going to founder and potentially die and have a lot of problems that the doctors have said, yes, treat the feet, treat the legs, treat the hocks, whatever or the shoulder, wherever the problem is that's developing and getting worse. We've been able to deal with those situations under veterinary supervision and certainly medical supervision at the same time. If you can't walk and you're going to fall down and hurt the baby or something, and it's that severe that you need to see your chiropractor and be dry needled or whatever, there are other opportunities available to help with those types of situations. So if you'd like to discuss that further, send me a text, 502-599-9722. And we can discuss that, or if you have related questions to that, I'd be happy to discuss them. Okay, and this is a practitioner question, and I typically don't cover these types of questions on the office hours, but it is a good question. I do want to cover it because we've got practitioners out there now that have been with us for a number of years. We started doing certifications, I guess, back in 2009 and 10 is when we started doing these certifications, and so people have been with us for some time now. It's 2018, but the question is, I'm having difficulty accessing the certified practitioners portal. I received my certification in August 10th of 2018. Your help would be greatly appreciated. That's not that long ago, but we've made some changes to the portal. We've launched a new format for the portal, so it is possible that your old password or your old login is no longer working. So if your password and login that you were using is not working, simply call the office, 502-742-7868, 502-742-7868, and we'll make sure that you're able to get into the portal to access the information that you're wanting to have a look at and refresh yourself with your memory and so forth with regard to the certification training. Also, let's see, and to that end, sometimes if you're copying and pasting a password into the portal, here's a common problem: is you'll scan what you're going to copy and paste, and if you look at that, sometimes it'll extend your little blue the little thing that covers the word you're going to copy. It just looks like another character, and you copy and paste that, it thinks there's a character there. So you want to make sure that your copy and paste, if you're doing that, is perfect end to end on your password that you are copying and pasting into the portal, or any other login that you might be using. I know I've had problems with that, and then I look at it and think, oh my gosh, why didn't I realize that when I was copying and pasting that particular kind of information? Okay, let's see. Good question that came up is, what is the best machine for the body when dealing with viruses? Well, and this is a medical type of question, whether it's human or veterinary, with regard to viruses. What we've kind of learned over the years is that a virus is not a bacterial type of thing, where improved oxygenation will help fight that bacteria and kill off that infection, or kill off that or fight that particular type of indication that's going on with the body. A virus is something that quite often you hear about it, you just have to go through it. You have to get through the virus, and it has to run its course, if you will. Okay, what I've experienced personally with those types of situations by treating myself is it has a tendency to push you through that a little more rapidly, a little quicker. And so what is the best machine? Well, certainly any type of PEMF device on your body, or any of the machines that we have that are high voltage, low frequency devices, more powerful devices, are going to provide that amount of energy to the body to potentially help push you through those situations potentially more rapidly, if that's something that your doctor feels like could be helpful or beneficial to you. I know that my wife has currently been having some issues, some flu-like types of issues, viral, if you will, and very in dealing with her lungs and trying to get the mucus broken up and that type of thing. And she's gotten great relief from treating her lungs to help break things up and again move the cough along, move the process along more rapidly. So I can't say which is the best machine, although a stronger machine is going to have more effect in terms of the pulsing and the massaging of the lungs, or massaging of the body to help that situation along. If it's a muscular virus type of thing, you have situations, well, it's kind of centered in my low back, or it's there, and that's where it is. You can kind of, again, treat it, stay on top of it to push it through the system. If you have any questions and that you'd like to post, just post it here into the chat box, and we'd be happy to answer them there as well. Let me come down and see if I can pick up the today's program to see if we've had any questions there. Let's see, let me get down there. Here we go. This should be it. MagnaWave today. Let's put it up. Okay, there we go. Let me turn my speaker off for sure. All right, if you have any questions, just put them up there, and I'd be happy to answer them. Sandy's with us this morning, top line. Thank you. Good morning. Relief Center. I kind of like that. Good morning to you. Mary is with us. Good morning. Janet's with us. Idle Hour is with us. Hazel's with us. A lot of folks. Is this last week's or this week's? That's about a week ago. This is the wrong one. Let me try to go back here and bring up today's is what I want. So I can visit with you and answer the questions that you may have. Takes just a second to figure out where it is. Let me refresh here. Sorry. Again, if you'd like to send me a text, it's 502-599-9722, and we'd be happy to answer any of your questions. I'm just trying to get down here to see if we've had any questions this morning. I can't see this. Here we go. There we go. We're up. All right. Terry's with us. Shelly's with us. Greta's with us. 12 other folks. 24 folks with us this morning. Wow, that's pretty exciting. I'm glad that you're here. If you have a question, please put it up, and I'd be happy to do it. Let's see here. Do you have a page on your website of all the clothing and materials that promote MagnaWave that can be purchased? We do. Great question, Barbara. If you go to the website and you go to the practitioner portal, it's on there. There's a spot when you go, I believe it, let me take a look if it's on the About page or exactly where it is. Perhaps if Aaron's with us, they can tell you where it is exactly on the website. But you go there and there is a practitioner portal. You go to the portal, and in there you're able to look at all the materials, brochures, gear, clothing, anything that you might like to help you with your business or provide information to your folks. If you don't know the password, I've done this before. I've given it out on the air. Then they have to go in and change it. So if you're not sure of the password, just give us a call at the office, 502-742-7868, and they'd be happy to give you that password and get you into the portal to see all the various products that are available. We have another question, I believe. Let me see. Greta asked the question, I just had a gym member fall, twist both ankles, and hit her knee. Can I treat her today? Absolutely, Greta. The quicker you treat, the quicker you go after an indication, the more rapid the response. You got to remember that what's going to happen here, someone falls, twists an ankle, hyperextends a knee or whatever, the body is going to, as a defense, going to try to protect that area. It's going to send blood flow there. It's going to cause inflammation and to come on to as a protective factor to begin with. What we want to try to do is get after the recovery process before the inflammation gets in the way. Quite often you have inflammation, and the inflammation becomes as much as a problem, or it makes it a difficult thing to get after the indication rapidly enough in order to get the recovery and the healing process moving along. So the sooner you go after these types of situations, the better. So if this happened this morning and you want to go in and treat both ankles and the knee, I would certainly say have at it and go for it. You want to make sure you're comfortable and the person is comfortable. You want to do it at a setting that gives them some relief and it still is comfortable. Good question. Let us know how it's going with that, Greta. That's wonderful. Can PEMF help with hiatal hernia healing? Well, you know, certainly if you've got a hernia, you've got a hole in the muscle area or in the area holding the tissue together, and what happens is the intestine, if you will come through that hole, start causing irritation and causing a problem. And so that in many cases has to be surgically handled in order to close the hole and deal with it so it does not become a problem. If you have something that's there that is not totally a hole at this point, but is a strain or a stress from something going on, and you want to try to enhance the healing process of that with the blood flow and the oxygenation, talk to your doc, and that could very well be beneficial at that point. But if it's something that they're saying we just need to let this calm down and heal and work with it, let's say if the doc says, well, you have a problem here potentially, but it might take care of itself if we watch it and do this, then there is a possibility there that the PEMF could be beneficial. Once the procedures are done, if they go in orthoscopically or if they have to surgically go in and do a repair, will the PEMF help the healing of that and the recovery from that after the procedures? Most certainly. So the PEMF is very beneficial from the standpoint of improving oxygenation, improving blood flow, which enhances the body's healing processes that it has going for it. So good question or good situation there. Let's see. Let me try to bring this over. Why won't it? Here we go. All right, so I can look more new comments. Let me take a look here and see what else we got. How often do we need to be recertified? Will we need to obtain continuing education hours? That's a great question, Barbara, and I want to kind of go over that, and it's kind of been interesting. Some folks folks that have been with us for a number of years, and we've started the recertification process, and there is some testing now that is required. There are classes that are continuing education classes that we have as part of it, and in some cases there is a charge for that. The people that came to Magna Con this year and came to the Magna Con, witnessed the speakers, asked questions and learned, had that apply as their continuing education for their continuing education required for recertification. If someone's been with us for the 2 years, it's a 2-year certification process. At the end of that time, there is a retesting required. There is new educational materials at that time we want to bring up, and there typically is I don't know what the charge is, but it's a nominal charge, $100, $200 to be recertified and to have the testing. And some people have complained, why are we having to do that? What is the reason for that? They wanted the certification. They want to have the additional education, but when it comes time to continue, and it's a very simple answer. As we continue to improve our educational products, continue to try to step up our position as far as accrediting agencies are concerned, or regulatory boards are concerned, when let's say it's a racetrack, or it's a dog show, or it's somebody somewhere saying, well, what is your training? What are you doing? Do you have continuing education? Continuing education is a part of most licensure in the United States. Doctors have to get continuing education. My brother's an undertaker, funeral director. He has to have continuing education and take courses and so forth to do that. So yes, there is continuing education required. In some cases, depending on when you came in and what's going on, there is a nominal charge for that information. It's a 2-year certification. If you have questions about that, you can again call the office. It's on the website, and discuss that with Erin. Erin is our Director of Training and Education, and she can certainly give you all the information as required to get that information that you're looking for. Great question. I hope that was clear enough, and I hope people understand that we do. Just for those who don't, when I started the education process, I went to some accrediting agencies, and I said, we want to be accredited. What do we need to do? We'd like to be a school. Da 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 da. What should I do? They said, start, improve, build. There'll be a time when you'll be able to resubmit, or come to us, or come to an accrediting agency, or go to a state board and say, look, this is what we're doing. We've done that. I mean, I've been to racetracks in the past, veterinary meetings at racetracks, and with the stewards and the boards, and they've said, well, what are you doing to show that these people know how to operate this equipment? And I go through our education, I go through our testing procedures and what's going on, and it's pretty good. And they say, oh, okay. And so as long as someone's got that, we can assume that they know what they're doing, and most certainly. Now, with that said, there's plenty of people that are professional in their practices that don't necessarily follow all the rules and don't necessarily follow all the guidelines, or keep themselves best educated. But we do our best and do everything we can do to make sure that any of our practitioners, or anybody who has this equipment that wants to obtain what the MagnaWave certification, which simply means they've had the classes, they've taken the tests, and they're following our guidelines in order to best practices for this type of therapy, to do that. And so that's why it is there, and that's why we're doing it. Good question. Thank you. Okay, there's an answer there for continuing education. Let's see. Let me go back and see if I've missed anything. What along the same lines, what education opportunities are available? A list of classes and courses. Laura, great question, and that's available. You can call the office and talk with Erin. As she posted, there is a place that talks on the website that talks about certification, what's available. I know we're adding, we're working with Dr. Dreesen, and we're adding specific classes, for example, dealing with ACL injuries, or dealing with knee problems and that type of thing. Very specifically how our particular therapies can be applied to those, because people want to know that. And that's all available, and you can see that we have courses in small animal, courses in human, courses in equine. Some people cover all three. Some people want to deal just with equine, or just with small animals, or just with people, and you can take the education processes accordingly for those various areas of study. It's not it's not like going to college. I mean, we're not doing that. It would be continuing education for many people who have had some education. It is an overview of the equine, to kind of explain that when people talked about why we did this to begin with. Well, as you know, you can take a look today, and I'll fall back on the AOPP here in just a minute, but you can take a look today. If you look at all the various websites that are out there for PEMF, there's a lot of information. And there's a lot of information that has been shared over the years from various websites. They'll pick it up here and they'll use it over there, and you'll find our information, because we've been around longer than many of these particular other people and other sites, and they'll have a lot of our information, or at some point they've doctored it and changed it. But at any rate, there's just a lot of information, and frankly, there's a lot of things that are said that are not necessarily on course, and they need to be cleared up. And that's one of the things that the AOPP, one of the missions of the AOPP, is to come into the industry and try to find some standardization. Try to put some, for example, power of machines. What is the strength of these machines? What are the Gauss ratings of these machines? And the AOPP is going out of the way to have testing equipment and to try to formulate where the various machines are in a class type of situation, as far as strength, as far as Gauss, as far as treatment time, so on and so forth. So a person can go to that and go to that website and see information that people subscribe and agree. As long, this is what it is, we subscribe to this, we understand, and this is how we're approaching it. So that's one of the things that we wanted to do when we had the training, is put everybody actually with the vocabulary, what we're describing, how it works, what it does, so everybody is on the same page, again, for standardization of education, standardization of understanding for those who want to use this personally or integrate it into their particular business, if you will, if they are a medical or a health practitioner and they want to offer these types of services. And we've come a long way in that, and a lot of people have worked along that as well, and I feel like the Association of PEMF Professionals will go a long way to help with the standardization and education processes in the PEMF industry, if you will. So there you go. Let's see here. Terry asked the question, I remember a new practitioner checklist that had great info for recommended action items regarding legal, promotional, biz building. Where can I find a very helpful form again? Terry, you can probably find that on the MagnaWave corporate Facebook page under forms. It'll be there under all the various forms. There's release forms, there's explanation forms, there's that checklist form that we recommend that people check out when they're treating a new client, if they're dealing with a veterinarian on a particular animal or whatever, or a doctor or chiropractor, as to what you want to treat and what type of indications you don't want to treat. You'll find that on the website in the practitioner portal under forms, and you can also find it on the MagnaWave corporate page, or even in the certified, if you're a certified practitioner, on that page under forms as well. So take a look there. If you can't find it, give us a call at the office, and we'd be happy to take a look at that for you. Okay. Let's see. Thank you. If you'd like to visit with me, send me a text, 502-599-9972. I think, is that the correct number? 97. No, my goodness, I'm giving the wrong number. It's 9722. 502-599-9722. Well, imagine that. There's the dyslexia jumping in this morning. So people are sending texts and wondering, where is he? 502-599-9722. And let's see. There's Greta's question. I'm going back to the beginning in case I missed something. Let's see. Pat, do you offer for sale your MagnaWave button-down shirts like the one you are wearing? Ben, I do believe they are on the website. If they're not, we'll put them on, because I love mine, and they're great shirts, and I know we've got a lot of various gear on there, and they are certainly available. And if you want one, we'll make sure that they're available to you. But check on the website under the practitioner portal for gear and so forth, and they are there. And if for some reason they're not, we're going to check this morning. We'll make sure that we get them up there. Great question. Thanks, Ben. Thanks for asking. let's look here and see, make sure that there's not something that I missed. Okay, if you have a text, send it through. Looks like we're pretty good as far. One other thing that you want to do, let's see, I've got the page on the website. Looks like we're pretty close. Yes, looks like we got most everything at this point, so that's great. Again, if you'd like to visit with me, excuse me, give me a call. It's 502-599-9722. Send me a text, and I will call you right back. Give you some free gear today if you'd like to have some MagnaWave news and views. Just do a little change up here. If you want another piece of clothing gear, give me a text and we'll know whether or not it's the news and views that's holding us up this morning with regard to somebody who might want to visit with us and ask a question. We'll stay as long as we have questions and conversations to deal with. I certainly want to do that and cover your questions that you may have. Just post them in the chat box, send me a text, and I'd be happy to answer them, or that's it. We'll take care of it in that fashion. But I was going to mention one of the things that we've enjoyed. Oh, here's a couple of messages here. Let's take a look here and see. Oh, I got one 23 minutes ago. For some reason, it's just popping up. Let me take a look at that here, and we'll make a call. Natalie wants to visit. Let me pull up Natalie. Here we go. Okay. Let's get Natalie here on the line. It's ringing. Let's see if Natalie's going to pick up.
Hello.
Natalie.
Yes.
Pat Ziemer with MagnaWave. How are you?
I'm good. How are you?
I'm great. You have a question?
Yes. So I am treating a client for really bad headaches. He came back from Afghanistan in like 2010 and has just suffered like really terrible with headaches. And when I treat him on the head with the butterfly loop, he says that he can like feel like the precursor when I like put the loop on there. So I don't know if that is an indication that it's helping or if it's making the issue worse.
What do you mean by feel the precursor? I don't understand.
So like the symptoms, like right before he has a really terrible headache. He like the pressure behind his eyeballs. He feels that when I put the loop on. So I don't know if that is either like getting to the problem or if that is like making it worse.
Well, I don't know that it would make it worse, but obviously if it comes when you put the coil on, you're having some action. There is action taking place in his head. How do you place the coils on his head? What do you do?
So the one coil goes like around his head, and then the other loop goes on his neck. So you're basically opening it up and putting part of it on the back of his head and part of it on his neck? Correct.
Okay. And what type of setting? Are you using a very low, comfortable setting?
Yes, very low setting when treating his neck. And then I also, the first session, I treated like his whole trunk and then also his feet on high as well. Okay, so you're on the correct path in order to give him the relief that he's certainly looking for. I would say you might try a couple of things. Instead of opening it up and putting on the back of his head like a cap, if you will, simply leave the loop closed and rest it on the lower portion of the neck and head, like right into this area, so you're getting the neck and the lower head here, so you're not putting pressure directly through. If that coil is up high, you're coming straight through like this, and that could cause him some discomfort potentially if he's feeling that precursor. So I would come down here on the lower back of the neck, treat basically his upper shoulders. Another thing that you could do would be to take the large loop, put it over the head and rest it on his shoulders, so we're going like this. Okay. Going this way back and forth. And so you certainly want him to be comfortable. And if he feels that, then change the positioning so he's receiving the energy and he's comfortable. But you could go over the shoulders, you could put the coil on the back, and if he's feeling it, turn it down. Okay.
And so we don't want to cause a pressure that he's instantaneously feeling as he's doing that. And then you're correct to treat the feet. When you treat the feet, are you using the large loop, or what are you using?
I just do put the butterfly loop on each of the feet and treat the feet separately. Okay,
and that would work. So you place both feet on the open butterfly loop as you're treating. That's fine. That's fine. Make sure that you do the whole foot. In other words, you'd have the heel and the arch of the foot in for a period of time, and then you drop it back to where you have the ball of the foot and the arch and the toes in the coil, so you're getting the whole foot.
That sounds good.
Because you remember, a reflexologist is going to go in and they're going to work. They know where they're working around the toes and at the base of the toe and into that. So you want to make sure that you get the whole exposure to the foot as a reflexologist would approach it to stimulate the nerves and everything that's in the foot that could be beneficial to other areas of the body.
Great. I haven't been doing the whole foot, so that makes way more sense.
Okay. All right.
All right.
Good deal. Well, thank you for calling. Appreciate it very much. Bye-bye.
Bye-bye.
Very good question, and you can see so often when I get these types of questions and things that we're talking about, it just gives us a good way to discuss it and have some follow-up. So if you'd like to visit with me, send me a text with your name, 502-599-9722, and we will get right back to you. Hazel's got a question. Let's see if we can get Hazel on the line here to answer her question and help her out and help everybody out. It should be ringing. Let's see.
Hello.
Hey, Hazel, Pat Ziemer here.
Hi, Pat. I'm working on a client right now. He got bit by a cat 3 weeks ago in his index finger.
Okay.
And he had to have surgery. They had to drain the pus out. He had a drainage tube in his finger for 48 hours.
Wow.
High doses of antibiotics. I mean, they treat cat bites seriously.
Correct.
So I had him put his hand on the paddle. It just seemed to make it worse, even on a low setting. So the doctor diagnosed him with cellulitis, and if he doesn't get the swelling down, he's going to have to go into therapy because he has no mobility in that finger at all. I started work. He's a big guy. He's like 6'5", 300 pounds. So I put the equine wings down and had him sit on it.
Okay.
For like 20 minutes, I believe.
Okay.
I just don't know what else to do.
Well, certainly you're doing the right thing with the equine wings, having him sit on it, doing his buttocks and his low back and that type of thing. I'd even move him up and do his whole torso potentially, because what you want.
I did open them up and had it, so it was covering like from his neck all the way down to his calves. Perfect.
And so now when you put his hand on the paddle, what was your setting?
It was really low. I have the semi, so it was really low.
Okay. What you might want to do in this situation is, even the paddle is putting out more energy, and certainly you have a healing process going on with his hand, certainly. And as you know, there's a lot of issues. Puncture wounds, type of wounds are the worst thing to deal with because it's so hard to get to what's going on. What I'd recommend is maybe put his hand on the butterfly. Rest his hand in the middle of the butterfly. Put it on low and treat it that way so he's comfortable. If he's comfortable and he allows you to do it, and you also want to do his arm. If we're trying to move out of that wrist or out of that hand where he's got inflammation, we want to make sure you're doing that somewhat coming out of the torso. You're improving the overall blood flow, but treat his wrist and his arm at the same time so you get good flow from there. So as you're clearing up, one of the conversations I'll have is, you got an accident on the road and the accident's there and everybody's rubbernecking and all of a sudden the accident's gone, but everybody's still looking at where the cars are parked on the side of the road, right?
Yeah.
And so we're trying to clear out that congestion. So you want to make sure that the ancillary roads, the arm and the upper arm, are clear and doing well. So as you move that, trying to move that oxygenation and that inflammation out of the wrist and hand and finger, it's moving up into an area that it flows smoothly. And that I'd recommend that. You're doing the right thing.
So maybe like the large loop and don't hot dog it?
Yes. Absolutely.
Okay.
That'd be perfect.
Okay.
That'd be perfect. And hot dogging it, what she's talking about, folks, if you don't understand, is taking the large loop and kind of squeeze it in so it's more long than it is round. And so you could put that you could take that and place it over the arm like this or up here like that, and get good blood flow from that particular area. But if he's feeling it, if he's feeling some throbbing in his finger at the same time, that doesn't mean it's bad. It just means that things are going on, and you got to kind of work through that. So work on the comfort level. If the right attachment gives you, for example, you could place his hand in the middle of the large loop where he'll feel nothing, but he's getting the energy and he's getting the PEMF. And again, in a critical situation like that, or in something that they're working closely with, that might be the way to initially approach it to get him through the process a little bit down the road.
Okay, I didn't think to do the arms, so that's a great idea.
Okay.
All right.
Good deal. Thank you for calling.
Yes, absolutely. Thank you, Pat.
Bye-bye.
Bye.
So there you go, another great question, and I've got both names, and so we're going to certainly get the information and get the MagnaWave news and views out to them. Ben's got a question here. Let's bring Ben up and see what he's got going on. Here we go. There's another one coming up. We're on the speaker. Okay, it's ringing. Let's see if Ben picks up. Come on, Ben.
Hello.
Hey, Ben. Pat here.
Hey, Pat. Sorry about shouldn't pick it up fast enough, but
It's all right.
the question I had, the lady before had a really good question, and I wanted to add a question onto that because I heard that if you change the position of the attachment rings and you kind of go, instead of laying the ring on somebody's body part, you pick it up and you kind of you angle it like 90 degrees and hold it there. They say when you do that, it's more therapeutic, or it doesn't make the body get so used to having it at one angle that it's not as effective. Is that true?
Well, yes, it's kind of amazing, but the tissue has been found to be more responsive when it's approached from different intensities and different directions. And I've wrestled with that, and what I always talk about is a horse's neck, for example. If I'm treating the left side of the neck and I'm getting movement and palpitation, and I go to the right side of the neck and I don't get anything, it certainly tells me that the left side has got some stress and some sensitivity, but that signal is going all the way through the neck. So when I'm treating the left, why isn't the right reacting? Well, that's because the left is where the issue is. And so the tissue responds, and they've often talked about that if you take, and my example is, if you take a coil and you lay it on someone's shoulder or put it on a horse's shoulder and you have it at a particular setting and you do the same setting every day, same location, after a period of time, the body says, I know what's going on, I don't need that. It kind of sloughs it off. But when you surprise, basically, when you change the intensity, change the positioning, the tissue always says, I like that. It's much like a massage. When you massage, they can't do it the same way. So every time they go in and they start massaging, boy, that feels good. I really like the way that's feeling. Well, the tissue is getting that and saying, I like it, I love it, please keep it up. And so that's what happens when we change the position and change the intensity. It just keeps the tissue aware and awakened to what's happening and to improve the body's ability to heal itself. Does that help?
That definitely helps. I'm going to start doing it on my clients because I don't have the issue of them not if I do the same thing it not being effective, but when it's turned at an angle, that might help them even better.
Sure.
If I'm treating them in that one spot with the same type of position.
Yeah, it's always good to move it around and to approach it in that fashion. Great question.
Thank you so much, Pat.
Okay, buddy. Thanks for getting to me. Bye-bye.
Okay, bye-bye.
Okay, that was a good question. We've got another one here. Let's see who this one is. It's a Magna Con question. Let me go back and see who's... Aaron. Okay, I believe Aaron's got a question. Let me bring up Aaron here and see what's happening. Come on. Dial the phone. Here we go. All right. So now we're ringing up here. We'll see what we've got here.
Hello.
Is this Aaron?
This is Erin.
And you called?
I did.
And what's up?
I was just wanting to let everyone know that the Magna Con 2019 dates are out already, and the tickets are for sale.
Ah, great. When is Magna Con in 2019? I need to know to mark my calendar and make sure I'm there.
It is going to be, now you put me on the spot, June, hold on a second. Well, while I look up the date, tickets are on sale now, but they are gonna go up in price after January 1.
Okay.
Just so everyone knows. And then, if you are gonna be due for continuing education in 2019, if you can make it to Magna Con, that is gonna count as your continuing education.
Perfect. And you're still looking for the dates. I believe it's in June.
Looking for the dates. It is in June.
Is in June again. New hotel this year. New digs. We're excited about that. And actually, the hotel is the Marriott here in Louisville on the east side of town, and it's where the bourbon tour begins. So if anybody goes on a bourbon tour to the different distilleries and all that, it always starts right there at this hotel, and it's incredible the way they've had it decorated and the history and the information about the bourbon tour. So those of you who might find that interesting, that's going to be a good fun aspect of the Magna Con 2019. You got those dates?
Pulling them up.
We're getting.
Okay.
Well, we want to make sure you come to Magna Con. We have a great time. This year, we're going to, the numbers have increased. Last year, we had over 200 attendees. This year, I think our top number will be 300. We're already talking to doctors, chiropractors, veterinarians, practitioners who will be speaking to us and be sharing their information this year at Magna Con. So it's a great place to come and learn about MagnaWave, PEMF, and associate and meet new friends with regard to everything going on.
Okay, the dates are going to be June 12th through the 14th.
June 12th through the 14th of 2019. Okay, Aaron, thank you very much.
Okay, thanks. I'll post the link.
Okay, great. Thank you.
Okay.
Bye-bye.
Bye.
Okay, so there's Aaron with the Magna Con dates. Let's see. We've got a question. When can we expect to get the gear if we called on a previous live chat with you? If you're talking about last week, I go to sleep sometimes. Here's last week's list, and I'm going to take care of it this morning with proper notes accordingly. So all that'll be going out of here today. To those who call in today, that gear and information will be leaving today or tomorrow. So I apologize for that type situation. Let's see if we can get a message with that because they texted in. Got a caller. We want to answer the questions that they have so they get their questions answered. Of course, here we go. We're 10 minutes approximately left in the program. One more ring, and then we'll go on to someone else if someone
Your
else.
call has been forwarded.
Yeah, so we'll go on from there. Let's see. Here we go. Got another one coming up. Okay. If you have questions, please send me a text. I'd be happy to visit with you. Put it in the chat box. I thought about this when I got up this morning. I was going to try to get 25, 30 people here with us today, which is incredible, and the numbers seem to be increasing. I want to start out next week and do it and ask you to share so your friends can know that we're here and maybe get it up. I'd love to get it up to 100 people on the line. Let's just say 50. Let's get 50 on the line with us in the future, because that just brings a lot of information to the table. A lot of good questions are asked in those types of types of situations. So we've got about 10 minutes remaining. If you've got something that you'd like to discuss with me, send me a text at 502-599-9722. Be happy to visit with you about any topic with regard to PEMF, MagnaWave, training, machines, whatever that situation may be. Or you can certainly ask your question, put it in the chat box. Camilla is with me, my niece. My niece is with me this morning, and I don't know. Erin's coming back. Let's see what's going on here with Erin, if she has some additional questions or comments for us. Here we go. As I said, Camilla's with us, my niece. Camilla, thank you for joining us. If you got a question,
You've
put it up
reached
there.
Erin Hughes.
Well, now I've reached her voicemail. So, okay. As I said, Camilla's with us this morning. That's cool. Andrew's with us this morning. Kathy's with us. Thank you for joining us this morning. We always want to visit and get things answered. Whatever questions that you may have. So, looks like things have slowed down here a little bit with regard to questions and people who would like to visit. That's okay. We understand. That's how it goes all the time, because we want things to be taken care of. So if there's really nothing else that we need to discuss this morning, I want to thank you for being with us. Join us on Alexa. Also join us on the Magnawave Education Resource International page, and where you can search for questions that you may have about MagnaWave or PEMF, and the answers are there. Erin's in the room. What do we got, Erin?
Tracy has a question about macular degeneration in the comments.
Oh, question in the comments about macular degeneration. Let me see if I can find that here. Thank you. Tracy, all right. Macular degeneration. Any additional information, testimonials? We've only seen, I've only seen one with no further updates and approaches. Great question, Tracy. Certainly need to look further. I'll do some more researching and see what else we can find on the macular degeneration type of situation. I do know that some people have had some good response using PEMF and C60 for the macular degeneration. There are one of our previous webinars. You might want to look on the webinars on the Magnawave website, where we did the webinar with Max Champy and his people about macular degeneration and the results that they're seeing. And certainly the primary method would be to take the coil, put it up to the head comfortably and the eyes, and treat accordingly. I was at a trade show last week in where was that trade show I went to? It was in Atlanta, and it was called MagnaCon, and I was visiting with some people that have some PEMF equipment that's specifically designed. They had two little deals that went over the eyes, specifically designed for treating eye problems, glaucoma, cataracts, degeneration, and a lot of times you're talking about situations where you have blood flow impingement, things are not right, blood flow problems, oxygenation problems to the eye, and to the ocular nerve, so on and so forth. So anything we can do to the body to help it have good oxygenation and good blood flow. Again, it's not a miracle. It's just the idea of giving the body support to better heal itself and better work with it. But Tracy, that's a great question. Take a look at the webinar with Max Champy and his people on the macular degeneration, and certainly by seeing that, and other people can share their experiences using this great modality to better enhance their body, to better heal itself. And certainly we have experiences over the years where many different indications receive favorable results when they set the body up to be more healthy situations, from the cellular basis at the molecular level, to allow the body to better heal itself. So Tracy, I hope that was helpful. Let's see, can we get, Terry asked the question, can we get an invitation with cool graphics or even video that we can use to invite friends to next week's call? Ooh, the man who handles that kind of stuff is in the room with me. Andrew's with me. Andrew, that's the question. Can we work up an invitation video or something that the practitioners and people can share with their friends to get them to come join us next week? Ooh, gosh, next week's going to be a problem because we're at Magna Con. Maybe we'll have to do this live from Magna Con. That could be interesting. But we're going to look into that. And Terry, the answer is yes. We can get some cool graphics and some cool video that you can use to invite your friends to a MagnaWave office hours. I am going to have to make a decision about what we do next Tuesday, because next Tuesday is the EquestriCon event here in Louisville in association with the Breeders' Cup, so we'll be dealing with that next week. So I'll make an announcement as to whether or not we have the office hours or a replay of an office hour. That could be. Andrew's got something.
I was going to say it's very important for them to share as well. So every time they're watching,
every time you're watching, you share that you're here, and that will certainly help. And really, just from a marketing standpoint, to talk about that, if you're a practitioner and you're watching the office hours, the most valuable thing you can do is to share that with your friends, with your potential contacts and clients, because they'll come, they'll watch, they'll learn. It'll give you additional credibility, and additional authority is a term that I like to use. So you have good authority when talking with your people, and they'll ask questions of you then that if you don't have the answers, which you will because you get the certification and so on and so forth, to help you build your practice. Great idea, Andrew. Thank you for that input, and we look forward to visiting with you then. So it's about time to say thank you for being with us today. Something that I've been talking about and picked up over the weekend, my travels to Atlanta to go to that particular medical show, read a sign, and it kind of hit home to me. Live your life in a more healthy manner and more well kept with MagnaWave. Have a great day. Thank you for joining me. See you next time. Bye-bye.